Hello, my name is Dr. Olaf Beck and I'm an orthopedic surgeon from Germany. Today I want to tell you something about knee replacement. What's the main indication for a knee replacement? This is a total destruction of the joint, which means all parts, the medial, the lateral part and the patellar groove, retropatellar structures are destroyed. During the last years it has changed a little bit, but especially in Germany, we are the country with the highest figure of knee replacement. So at least it's a business. And a lot of knee replacement are not necessarily, because it would be possible as well to regenerate the knee. So what's the indication for a knee replacement? I always tell to my patient that the indication has to come by the patient and not by the surgeon or someone else. So the right time for a knee replacement is when it cannot get worse. Why? Only 25%, 30% of the patients who have performed, have done a knee replacement are pain-free. 70% of the patient almost have pain, and from the 17%, 30% have even more pain than before. So you not have a possibility of 50-50 to get a better situation. For example, if you can perform before this kind of treatment 2 hours of walking, and after the replacement you can walk only for half an hour, you have lost 1.5 hours of your activity. The knee prosthesis is a compromise, and it's only for one part to get a pain-free or painless situation for doing your things you have to do for your daily living. It's not for sports, it's not for more activity, it's for only a small indication to improve and to get a better life situation, to reduce the pain. Because of this, it's very important to do anything for preserving your knee, because it's the biggest and the most complicated joint of the human body, and it's not possible to reconstruct this joint only by 2 metal parts and with a plastic meniscal insert. And this is the reason why the patient have even more complication after a knee prosthesis. And there's also a high risk of infection after this procedure. And if you get a joint infection, this is the worst case ever, because fully treatment is not possible. So there is a highly risk for low infections, and that means there are also bacteria into the joint, and after replacement of the knee prosthesis there's also a risk that you get even more an inflammation, an infection. Therefore I suggest, in the most cases, not in every case it's possible for sure, to regenerate the cartilage, the meniscus, the ligamentum structure to avoid a prosthesis. And if this does not fit until all of the rest of your life, so you get 5 or 10 years with your own joint, and then you get 10 years even more after the knee prosthesis implantation, because the knee prosthesis does not fit for all of your life. It depends of additional diseases and your sport activity or your business activity as well. So you have a period of 10 to 12 years, and after this time you have to replace the knee prosthesis. And after every replacement you will get a worse situation, because cutting off a prosthesis you will lose bone, and soft tissue is touched, and that will cause in scars, and scars are not so elastic than the other skin. So the risk of less bending or even stretching is very high. And so there's no 100% that you get a pain-free situation after a prosthesis, and for the future to avoid further operation. And this is the core of my intention and my therapy here in Cologne, where we will check out your MRI, which you can send us via retransfer, and you can stay in contact for the first time via our contact form at our homepage. And at the homepage you can get further information of the kind of therapy that we will offer. So all the best for you and for your joints. From Germany, Dr. Beck.